Hey, my name is Jade, known around the web as Backline Nurse, and welcome to my very first YouTube video that I had to shoot twice because my shirt was on backwards. Off to a great start. Public health, a field that previously not a lot of people who weren't working in it didn't really think about, even though it encompasses literally anything that can impact your health or the health of a population. Today we're talking about unsung heroes of public health, past and present. Here's the thing about public health. In an ideal world, the government would be the ones in charge of implementing these interventions and taking care of its people. But due to a myriad of circumstances throughout time and everywhere, that hasn't always been the case, and still not the case much of the time. In 1953, there was a tuberculosis outbreak among the Cheyenne River Sioux tribe in South Dakota. 4 women, now known as the Lakota Grandmas, banded together to find a notorious person who had been spreading active TB among their tribes. Their effective management of the outbreak led to the creation of the Lakota TB Health Association. Not only did they effectively stop this infectious disease outbreak, but they also performed epidemiological surveillance and public health interventions for chronic conditions that were plaguing their communities, including alcoholism and mental illness. Later on, the Indian Health Service developed the Community Health Representative Programs, which were heavily influenced by the work of the Lakota Grandmas, and they directly helped manage it. Next, we're going to Bobby Seale of the Black Panther Party. The positive impact of the Black Panther Party on the health of the communities in which they lived is unquestionable. But if you grew up white and very privileged like myself, you may not know anything about it. The Black Panther Party, seeing their communities neglected and mistreated by the medical community, prioritized the health of the people in the communities in which they worked. Black Panther Party issued a nationwide order in 1970 mandating that all U.S. Black Panther Party chapters had at minimum a free breakfast for children program and a free health clinic staffed with volunteers. These clinics were called the People's Free Medical Clinics, and they helped people of all races and ethnicities that had been otherwise forgotten by the larger medical community. They fostered collaboration between wealthy white grocery store owners to provide free food for kids who otherwise wouldn't have breakfast before they go to school in the mornings. The implementation of public health initiatives that the Black Panther Party did all on their own is so impressive that I just don't have time to cover it all here, but I am working on a separate video that covers that particular group in more detail, so keep an eye out for that. All right, let's move further up to closer to present day with Dr. Steve Larson in Philadelphia. Dr. Larson is an ER physician and associate professor at the University of Pennsylvania who started a free clinic to serve undocumented immigrants. They treat patients that otherwise wouldn't seek care because of lack of insurance, being prohibited by cost, and fear of deportation. The thing is, you can't work on public health without addressing the health of every single person in your community. Just because somebody doesn't have a green card doesn't mean that number 1, they don't deserve care, and number 2, that they can't spread illness to other people in your community. Dr. Larson's clinic, named Puentes de Salud, treats 10,000 patients per year. Dr. Larson's dedication to serving underserved communities and advancing public health as a whole is unquestionable, spans his decades-long career. If you want to know more about him and the work that his clinic does to help undocumented immigrants, check out the documentary Clínica de Migrantes on HBO. I'll put a link in the thing. Before I talk about this last person, I want to know if you've noticed anything in particular about the first 3 that we've talked about. Number 1, they're all people of color. Number 2, they're all from marginalized communities. And number 3, the advances that they made for public health were all in response to not receiving the help that they should have from the government or the medical community. And last but certainly not least, I just learned about this woman today and I already love her so much. Sister Astrida Banda, who is a Catholic nun and social worker in Zambia. Sister Banda is a longtime advocate for the public health of her community in spite of not actually being a medical worker herself. Upon the arrival of COVID-19 in Zambia, Sister Banda noticed that the bulletins being issued from the Ministry of Health to the people of Zambia were in English only. While English is an official language of Zambia, many of its citizens only speak one of their 7 local languages. So many of Zambia's citizens were missing out on crucial information that could keep them safe. And in the true spirit of public health, which is to make health and safety equally accessible to all, she decided to do something about it. Sister Banda approached the Yatsani community radio station and began doing radio broadcasts where she translated the health bulletins into all 7 of Zambia's other local languages. Her show airs 3 times a week. She has guests on the show from local communities talking about issues that they're facing and answers questions from callers. Her show reaches 1.5 million people and has created a community in Zambia where people keep each other informed. That's just so cool. Sister Banda has said, "This whole pandemic has brought humanity together." Unfortunately, I don't know if that's been true everywhere. In my time studying public health and especially global health, something that I notice are that communities in very low resource settings are often more innovative, more collaborative, and look out for one another better than we do in industrialized nations. So I was really excited to learn about Sister Banda this morning. She's bringing important information to her listeners that is keeping them safe, but also bringing them some hope and a sense of community. That's exactly what I'm trying to do here with this YouTube channel. I can't wait to talk more with you. I have a Patreon page where I post weekly blog posts, but even if you can't subscribe there, please like and subscribe here. Find me on social media. Tell me about things that you want to learn about. All right, please like and subscribe. I'll see you next time.